I think for us at this moment in time, given the pressures we have locally within our healthcare sector, within NEL, our biggest use cases at this moment are around trying to reduce the length of appointment contacts in terms of non-clinical work. So I think touching on what Sharon said previously, if we can get pre-appointment questionnaires out to patients ahead of time, then that can try and make our clinical contacts more face-to-face and less EPR recording. One of our biggest burdens we have is the amount of clinical time spent on documentation. So if we can reduce that at all and support that process, then, and again, you get the qualitative benefits of not having to ask the patient again their information. The second thing really for us is around supporting the agility with appointment management. Really for us, high levels of DNAs, patient groups with busy lives, changing appointments, changing processes, kind of appointments for children's services, etc. The ability to be able to have that direct integration from an appointment feed for us allows us then services to manage their clinics accordingly and reduce the number of DNAs we have and increase the amount of patients or the amount of appointments that a service can offer, so to increase our efficiency and productivity in that way. So there for us at this moment, I think from a digital side, two of the things I'm being asked for. I don't know, Samir, if there's anything else from a clinical side that's been asked for in mental health.
It's about, as you say, giving patients that bit of control over their appointments, about when they need to be seen, about being able to message us without necessarily picking up a phone. But it's also about getting the right information early to clinicians so that they don't have to dig around, GP notes and things to find the right thing. If they know the really important pieces of information, which may only be 2 or 3, well before they see that person, then that process becomes much faster, and you may need to see them less. So, which then feeds into efficiency as well. So, those are the kinds of things that we want to do with reducing our admin burden, but looking at it in lots of different ways.